Hi guys, it's coming on 6 right about now. And I know that we'll probably have people start to funnel in, the last few people start to funnel in. And so what I'll do is have us do a little icebreaker. And I will put in the chat box the questions. So the first one is your name. The second one, well, let me do it all in one. You get to, hi, my name is Robin, and I always mess up technology. One is name, two is your school and specialty. And three is whatever you're watching right now that you're really excited about. It's super quick. Right. So I have a list of you guys in an Excel spreadsheet, which should come as no surprise because I know you all really well and y'all don't really know me. But I will quickly tell you, my name is Robin. I am the director of the AX Scholars Program. I'm not sure if Brooke is going to join us tonight, but she is also my colleague in Southwest Louisiana. And my last degree is from LSU HSC in public health. I have a master's and I just finished watching a cartoon called Gravity Falls, and it's really great because it has lots of mysteries in it, but it's for children. So I don't know if you're into that kind of thing. All right, so Bryston, are you with us? What about?
I am.
Okay.
Sorry about that.
We'll start with you and then Andre and then Andrew. All right, go ahead, Bryston.
Well, I'm Bryson Thomas. I'm at LSU School of Medicine. I'm not watching any TV shows right now. I've just been watching the football season, so that's kind of what I like to do.
Okay,
I'm sorry. Did Bryson say a school and specialty?
Yes, so LSU School of Medicine. Yeah.
Great. Sorry, that was me. All right.
Okay. All right, please. I don't know how to get this background off, but hi, I'm Andre. I'm a pharmacy student at LSU. I mean, at Xavier University, and I'm currently watching SpongeBob, obviously. Yeah.
All right. Thank you. Andrew?
I'm Andrew. I'm a third year at LSU in New Orleans studying medicine. And I've been busy lately and haven't been catching up on TV too much. I've been watching some football here and there.
So I'm going to do the next three. It's is Dominique with us, and then Dana, and then Denitra. Is Dominique here? Okay, we'll go ahead and do Dana and then Denitra.
Hi everyone, I'm Dana Smiles. I'm a PhD student, third year at LSU HSC School of Public Health, and I'm in the Department of Behavioral and Community Health Sciences, so more of a sociological perspective to public health. And I'm rewatching Schitt's Creek right now and really enjoying it.
Cool. Thank you.
Hi, my name is Denitra. I'm in grad school, the Psychiatric Mental Health Nurse Practitioner Program at McNeese State University, and I'm watching The Voice.
Excellent. All right. Do we have Erica, Hannah, and then Jackie?
Hi, I'm Erica. I'm a second year pharmacy student at Xavier, and I'm rewatching Scrubs right now.
All-time fave.
Hi, I'm Hannah. I'm a second year at the LSU School of Medicine, and I just finished rewatching all the Twilight movies. It was awesome.
Right. And then Jackie?
I'm here.
Hi.
Hold on 1 second. Hey guys. First of all, I'm driving. Hi, my name is Jackie. I am a nursing student at Fletcher. What was the other question? What am I currently watching? I am watching nothing at this point except my grades in Canvas. I watch no TV. I watch nothing else. I wish I could watch TV and binge watch. I have so much on my Netflix list that they keep saying, "Are you watching?" Eventually, I'll watch it, but not
All
right
right,
now.
what's next? What's next? What are you gonna watch next?
Oh my goodness. I don't know. I've been hearing a lot about Nurse Ratched.
Okay.
Like that keeps coming up for me. I don't know. I just really just want to take like a day or two and just watch TV. I'm a first 48 binge watcher. So when I do watch TV, that's like one of the only things that I watch. First 48 or Dateline. I'm obsessed.
Okay, gotcha. All right, thank you. All right, so it sounds like we have some Scrubs fans in the chat box. So maybe that's a after work one for us. Let's see. Okay. Who was next? So that was Jackie. So all right,
Next.
Jackson. I'm sorry.
Oh no, I just said I'll go next.
Oh, I'm sorry, Rashonda. Go ahead.
Hi, my name is Rashonda Tate. I am an MPH student at Regis College online in Western Massachusetts. I have my little son right here, my little boy. So my screen is gonna be blacked out for majority of the time because he's kind of all over the place. But I'm currently watching The Office. I love The Office.
Office is great. It's with Scrubs up there.
Yeah.
So I got Jackson. I think you go by Jack, Jaylene, and then Juhi. And correct me if I get anybody's pronunciation wrong.
Hi, everyone. I'm Jack. I'm a second-year medical student at LSU School of Medicine. So actually, I'm watching the show called Normal People on Hulu. Very good. Love the acting. So.
Cool. Thank you.
Hi, I'm Jalen. I am currently at University of Louisiana at Lafayette in the Health Service Administration program. I haven't really been watching much TV because I am a very new mother of two. So I've been having my hands full. I'm really tired. That's it.
We have some empathy on the call for you. Yeah, Jack is giving you a hand. I think, yeah, let's all give the mamas a hand. It's big, hard, and daddies, if there's any daddies. Okay. Next.
Hi, I'm Juhi Patel, and I'm a third-year student at LSU School of Dentistry. I just completed watching Selling Sunsets on Netflix, so that is another interesting show.
All right, cool. Thank you. Callie Chow, Kennedy Wilson, and then Lane.
Hey y'all, I'm Kelly. I'm a first year MD MPH student at LSU. And I think Dana also said this, but I've also been watching Schitt's Creek. I'm on the last season, so.
Great. All right. Thank you. Kennedy? She might be on mute.
Oh, I'm here now. Sorry.
Okay.
Hi, I'm a nursing student at Sewell Lake Charles. Well, we're currently driving to Jennings because of Hurricane Laura. But the show I'm into right now is The Haunting of Bly Manor. I am really into horror series.
Great. It's a good, perfect season for it.
Yes.
Lane? All right, no Lane. Are you on mute, Lane? Okay. All right, I got Laura, Ram, Matthew. Oh, no, Matthew. Okay, Laura, Ram, Megan, and Nakia.
Hey, I'm Laura. I go to the Chicago School at Xavier, and I'm a 4th-year clinical psychology student. I just finished watching Schitt's Creek, still trying to process that, and I'm on to Bly Manor.
I know that feeling. I was like that when I finished Hoarders, frankly. I know.
Same way with Hoarders. I watched that, and I'm just like, oh my gosh, I need to take a minute.
Yeah. All right. We got Megan.
Hi, Megan. I am a second-year PhD student at LSU New Orleans School of Public Health. I'm not really watching any TV shows right now, but we just got Shudder, that Amazon add-on, whatever it is. So we've been going through and watching all of the horror movies on that.
Good. More spooky season. All right, Megan. All right, Megan, you just went. I'm sorry. Nakia.
Okay. Hi.
Oh, you quit.
Pharmacy student.
Nikki, I think your connection's bad. If you wouldn't mind, do us a favor and type into the chat box and I'll read it for you. Or you can say it once you get your connection back, whichever works. All right, let's do Noah and Sydney and Tavin. You'll have to tell me which is right.
Alrighty, good evening. My name is Noah Williams. I'm a junior at Xavier University, and I'm a biology pre-dental major. And I'm not really a TV person, but the last movie I watched was The Haunted Mansion with Eddie Murphy. So that was pretty good.
Eddie Murphy. Big thumbs up.
Hi, my name's Sydney. I'm a L2 at LSU School of Medicine, and I haven't been watching any series, but I have been watching the 31 Nights of Halloween on Freeform. So.
And Taven. Are you here?
Okay, can you hear me now? I'm sorry.
Oh, yeah.
Hi, I'm Taven. Yes, it's Taven, like Raven. I am a senior at University of Louisiana at Lafayette. And currently I am also watching Schitt's Creek. So see, a lot of people are clearly into that. So if you like sarcasm or comedy, that's definitely the show to go to on Netflix.
Yeah, thank you. Nakia just typed in that she's a second-year pharmacy student at Xavier, and she's currently slowly watching Blacklist. So if there are any Blacklist fans on here. All right, let's see. We got Tommy, Ushma, you'll have to tell me which one's right, Vicky Ann, and Whitney. So Tommy, you first. Tommy, are you on the call? All right. And now, Ashma?
It's Ushma.
Oh, sorry.
No worries. I'm an L2 student, School of Medicine student at LSU New Orleans. And I'm rewatching That's So Raven because my roommate has Disney Plus.
Nice. All right. Thank you for the correction on your name. Vicky Ann, and then Whitney. Vicky Ann, are you on mute? What about Whitney? Are you here?
Yeah, I'm here. Hi.
Hi.
I'm Whitney. I'm a first-year student at the School of Public Health at LSU New Orleans, and I just finished watching The Boys on Amazon Prime.
All right. Thank you so much. Okay. I think we have a few people who didn't yet introduce themselves, namely some of my current cohort of scholars that have been with us for a year. So is anybody I think I saw Shakara. Are you here?
Yeah, I'm here.
Do you want to introduce yourself as well?
Sure. I'm Shakara. I am a 4th year at the Chicago School at Xavier University. And as far as what I'm watching, I am rewatching The Office as I'm doing this internship stuff.
Okay. Sounds like we have some themes here. Sounds like we have The Office, Schitt's Creek. I was asking, I think, I chose that as a icebreaker, not because I'm a big TV person either, but because it seems like even non-TV people are TV people right now. So I thought that might be a pretty good one. All right, is anybody else on the phone that hasn't yet introduced themselves?
Hi guys, I'm Tassine. I'm actually in this for our 2019-2021 cohort as well with Shakara. I'm a 2nd year MPH EPI student at the LSU School of Health Sciences Center. And I can't remember what's the last show I've watched. I did finish a book recently, which is a very rare thing for me, but I finished Dan Brown's Origins, which is I think the Robert Langdon series. So that was really good. But that's something that I finished. So I wanted to mention.
I am so glad you said that. I should have said, what's the most recent book or what's your most recent media intake? Proud of you, Tassine, for finishing a book. That's great. So I want to maximize our time together. And so I'm going to quickly do the housekeeping stuff. And so that way we can get through that. And then we can leave the rest of it for explanation and time. So I'm going to send you all, well, let's see, one thing, hold on. This is always the fun part. I'm going to share my screen and I'm going to show you our Google Classroom. We will use Google Classroom primarily for our, there, can you guys see it? We will primarily use Google Classroom to manage our stuff. And so I have created an assignment for orientation. And in here, you will find a few documents that are supposed to help you throughout the program. One thing you'll find is something called the Quick Start Guide, which I'll also provide you copies by email. A learning opportunity decision tree, which I'll explain in a little bit. Stipend agreement, photo release, and a copy of the handbook. Now, we're just going to straight up go through the handbook because I made this thing and then I don't think anyone looked at it last year. And so I wink if you did read it, Tassine, because I can see you right now. So, okay, so we're just going to go through the handbook together rather than me creating a whole PDF or a whole PowerPoint. The big thing I want to tell you is that you have 3 things you need to get to me within the next 7 days. One is the stipend agreement and another is the photo release form. Those 2 things need to be provided to me they need to be wet signed, so with pen and ink. The photo release form is just this. It says that we can use pictures of you for like in our grant reports and on the website and things like that you're comfortable with that. And the other document is the stipend agreement. And this one is just very clear about why and how you'll get your money. And so over the 4 semesters, you have one disbursement. Remember, it's $2,000. It's broken up into 4, so $500 a semester. The first semester, you submit a windshield survey and reflective journal. The second semester, you have to provide 40 hours of classroom learning and 40 hours of service learning. Normally, and for year 2, you'll just turn in 20 hours and 20 hours each semester, but you're already halfway through this semester. And so it feels bad to require you to do 40 hours in like a month and a half. So all of your service learning for disbursement 1 and over the fall and spring of this current year will be due in spring. Next year will be broken up over 2. Now, it's probably clearer if you read this than it is what I just said. For fall I need to change the dates on this, but so for next fall, you need to have the literature review in the reflective journal. Let me make a note to do that, 'cause it's a binding document, change dates. I'll upload the new one on the stipend agreement. That's the thing about doing these meetings yourself, you have to take your own notes. The literature review and reflective journal will be due on disbursement 3, and scholarly paper and oral presentation along with the reflective journal will be on disbursement 4. And so I'll get into what all that stuff is in just a minute, but I just want to make you aware of that this is the document, and there's also some other stuff about participation, defining participation, that will get you paid. So this is a really important thing that you get me. Now, let's see. The other thing you have to do, the third thing you have to do is an evaluation. It will go, 2 different evaluations will go live at the end of this meeting. One is a baseline survey. So we have to demonstrate to HRSA that we are actually providing you a service here. And so we need to know if we have done anything in terms of, your skills and knowledge. And so we'll need to take a baseline survey to do that. It's required. It's part of your participation score. And then another survey is also there that should take about 2 minutes, and it's just about this session and how we did. And so that's a really short one, but all of this will go live on Google Classroom in a little bit. So let's start going through I'm looking because oh, here it is. All right, let's start going through I'm just gonna check and make sure I'm still, let me switch my screen so that you can see this. All right, can you see the handbook? Is that what's on screen? Tassim, will you nod if you can see the handbook?
Yes.
The only person I can see. Okay, thank you. All right, so I invited Tassim and Shakara to come today to provide some additional perhaps depth and perspective, and if you want to ask them questions about like what was that like, then you can have a different perspective than my just like sort of functional administrative perspective. And so hopefully that will help orientation be a little bit more thorough and helpful. And so let's all take a big deep breath. We are going to begin at the beginning. So AHECS, Area Health Education Centers, that's what that acronym stands for. And they were developed by Congress in 1971 to recruit, retain a health professions workforce committed to underserved populations. And so now, since 1971, AHECS have education services for the entire life course of a professional, beginning in grammar school, getting kids interested in health professions, all the way on to AHECS Scholars, and continuing education credits for professionals. So, and we really try to focus on continuing education and other services that will help bolster our ability to care for underserved populations, meaning rural and urban. So there are, I think, like it says here, about 300 AHEC program offices and centers across the nation, and it serves over 85% of the US. That's important because all of those programs and centers have an AHEC Scholars program. So you're actually part of a larger nationwide network of AHEC Scholars. And one of the big efforts that we're making at the national level is to try and get it so that the scholars cohorts are kind of educated together nationwide. And so we'll facilitate that through a shared calendar and some other things that we're hoping, conference, but that's all a lot of legwork and effort, and none of that exists yet. But you'll see little bits of it throughout your career coming to fruition. But that means that also your AHEC Scholar Certificate will mean something, because entire cohorts of medical schools and nursing schools and lots of other places are producing AHEC Scholars. And it is definitely something that's great to have on your CV. We rely on 3 different types of learning to teach that patients, broadly defined, I wrote this sentence earlier today and I'm very proud of it, are partners in shaping and delivering the educational experience of today, as they are partners in shaping and delivering the care experience of tomorrow. And so the idea is that, you know, we do a lot of things as you know, I include myself in this number as a public health professional. We do a lot of things to communities and on their behalf, but doesn't necessarily mean that we're doing what they need or want. And so we want to be sure that we partner with the communities that we'd like to serve, rather than, you know, just do things to them. So in order to do that, we rely on classroom-based learning and also community-based learning. And the bridge between those 2 types of learning is a reflective practice. And so every semester you have to submit something called a reflective journal. And when you submit that reflective journal, when you go to write that reflective journal, you'll be asked to really reflect on an experience that you've had in the last semester, and sort of flesh out what you experienced, how you felt about it, you know, what would you like to tell your future self about it? And so that way, hopefully you'll internalize the learning a little bit more deeply and gain a different perspective to their practice. And collectively, over the course of your scholars program, that will then change how you will approach your practice as a professional. So I'm going to pause there and see if anybody, that's like sort of the foundation of it, the sort of like the thought process behind it. I'm going to pause and see if anybody has any questions. Okay. Rashonda said, oh wait, Rashonda said that we can see the handbook. Okay, good. Just checking the chat. All right, let's see. So you all know what it takes to be eligible because you're here. So I'll skip that. And we're now digging into the actual nuts and bolts of what you guys are going to do over the time. So I'm just going to scroll down to this. So this was probably on the back of the flyer that you saw. And the idea is that over the course of year 1, you'll identify and engage with a community. We have these 6 core topic areas. I can't believe I didn't mention this. Oh, it's because it comes up after this. I just reworked the, let's go straight to the core topics first. Okay, so we have 6 core topic areas that we're trying to do all of that didactic and classroom learning in. One is interprofessional education, behavioral health integration, social determinants of health, cultural competency, and practice transformation, and also current emerging health issues. They're all pretty much self-explanatory. So interprofessional education, most of you know, it's like where different people from different practices learn to work together. With a patient-centered perspective. Behavioral health integration is bringing behavioral health therapy and other like mental health models into the primary care practice. Social determinants of health include 5 key determinants that impact health. So economic stability, education, social and community context, health and healthcare, neighborhood and built environment. We're going to start there. Cultural competency is pretty straightforward. It's not straightforward in practice, but it seeks to improve individual health and build healthy communities by training care providers. to recognize and address their unique culture, language, and health literacy of diverse consumers and communities. And then practice transformation is really about the improvement of patient-centered care. And it's about taking some of the stuff that we've learned from other fields. So about quality improvement and improving the bottom line, bringing that into healthcare and making it patient-centered. Okay, so, and then I have included here a list of key terms just so that we have some shared language. I will encourage you to review those key terms on your own time. I don't think it's fair to do this to you. So, all right, we'll go back up here. So anybody have any questions about the 6 core topic areas? Because that will come up over and over and over again. Okay. So over 2 years, what we're going to do is ask you to cultivate a deepening understanding of those 6 core topic areas by identifying and engaging a community over 2 years, right? To analyze and evaluate a health concern that they care about. And so in my mind, when I was developing this, and it was not COVID, remember, this was developed in non-COVID times. What we would have done is begin at the beginning by clearly identifying risk and protective factors in your community of interest in terms of health outcomes and community conditions. The way we were going to do that is with a wind chill survey. We will still do that. The idea is that you can drive around or walk around a community and actually look at it. We have a big habit of just inhabiting spaces and not actually paying any attention to what's going on around us. And so we have a whole framework for that. It's on Google Classroom. You can look at it later. And then that we would also do a literature review later. So as you, ideally, you would go do your wind chill survey, connect with the community of interest, develop a relationship with them, develop a research question with them, and then do a literature review. It's going to have to be a little different. I mean, that's just the reality of things. People have really approached this in different ways. And I think the scholars who are on can tell you about maybe how they've struggled and also how it's worked for them over time, I hope. But, you know, it's nothing short of a lot of discussions. You know, it's not nothing to develop a research question. And so it's just something we'll have to figure out, just like everything else. Some of the students who are doing more hands-on care who can't now are, for example, doing stuff around insurance and policy. And so it's easy enough to shift around as long as you're flexible and curious. So, and then the following year, you'll do a community assessment, which I have broadly defined. I don't even have a real framework for this because I don't expect you to turn it in, but it's to begin writing your paper basically in earnest. So you take your literature review, start connecting it to your community of interest, and you start trying to work out between what you saw in your wind chill survey, what you saw while volunteering, and what you're finding in the literature. You begin assessing the community with respect to the research question. And then eventually, towards the end, you will find a date to present to your the community of interest, because you want to always share back your learning. And then you'll present your paper and oral presentation. So that is an overview of the work. And then the final thing is there are a few ongoing, just like I mentioned. So there's quarterly, your 4 reflections, and then there's the 40 hours a year of in-class learning and 40 hours a year of out-of-class, community-based learning. So I'll pause and see if there are any questions. Okay. All right. Now, so you're probably like, you're going to provide all those 40 hours to me, right? And the answer is probably not. What I can do is provide to you places I think are really great places to collect some learning hours. Service learning in particular is something that I know I can't provide a lot of support for. It's kind of going to be on you to find an organization that you want to work with. Primarily, this is because I want AHEC Scholars to really be something that suits your interests. And if I have like 4 things I can offer you that I have relationships with, it may not reflect the full suite of interests that you have. And so it's my hope that people will really use this as an opportunity to leverage $2,000 to think about what it is that you want to think about. In terms of didactic work, that is something you will have more support from me from. In that respect, like I said, I will provide to you a list of approved activities that you can engage in if they are interesting to you. But just like the service learning hours, there's a lot of opportunity for you to really chase your interests and find a lot of, say, grand rounds or I mean, so grand rounds is pretty specific to medical school, but I'm trying to, like seminars in your department or outside of your department. Now it's particularly easy because no one can travel anyway. A lot of places, summits and things like that, are you can just catch the sessions online, and it's really cool actually. So, so that's a little bit easier. If you're someone who is already regularly volunteering a lot, you're fine. It adds up pretty fast. The tool we use to track is called Track It Forward. So you are going to get, like I said, this quick start guide. And in the quick start guide, you're going to be able to find kind of like a short reference of the things that you need to do. I'll put it up in just a second. And it includes Track It Forward and Google Classroom. But I just want to point out before we get into tracking that when it comes to your learning opportunities and identifying your own learning opportunities, you will need to do a little thinking. So I have created this learning opportunity decision tree. Ta-da! And what this is that if you find a learning opportunity, you have to decide if it does or does not work for scholars. So your first question is—
I don't think we see the chart.
Oh, thank you.
Yeah, no worries.
Thank you, Jack. 1 second. It's easy. You get into a flow and then you forget that people can't see what you can see, that you're not omniscient. Okay, let me see. New share. That's great. Nope. Okay. Give me a thumbs up, Jack. You can see it? Yeah, okay.
Yeah.
So this is, now let's, ta-da! I can see how funny that was in hindsight. But all right, so you found a learning opportunity. Let's see if it works for scholars. So the first question is, does it fit into at least one of the 6 core topic areas? If the answer is no, then don't do it for me. You can do it anyway, but don't do it for scholars. If it does, but the question is, will you learn something new? If not, then you can consider the following factors. Who is affected? Is it designed to engage people, or is it a service? So in other words, are you going to take a bunch of blood pressures and not really talk to anyone about where they live or what they do all day? You know, are you going to work behind the at a table at a baby fair and hand out things, but never have, like, it's not community based, it's not, you know, so does the project build capacity or facilitate another project or service? In other words, remove barriers to entry. What are the consequences if this does or does not exist? And so sometimes you're like saving the day, and I will never stop you from saving the day. And then finally, and this is not a totally inclusive list, but this is just what I've come up with over this time. Was it organized or requested by the community of interest? So if it was organized or requested by the community of interest, that kind of trumps everything. And so then if that's all true and you're not going to learn anything new, contact me or whoever your advisor is to discuss your idea, and we have to decide. I will say these days I have kind of lowered the bar here for counting, especially service hours because of COVID. But if when life goes back to normal, we'll have to renegotiate. And so let's see. Is that good? Her feel okay with that? Okay. All right, so this will be available to you on whenever you go into Google Classroom. Okay. Let's see. So sort of with that in mind, let me share again. Okay. So here's a really good example of what I was just talking about. So let's say you want to do Habitat for Humanity. It's a service, right? And your rationale is that affordable housing is increasingly scarce and that there's a correlation between mental health and physical health and housing stability. So volunteering would increase affordable housing stock, improve the health and well-being of disadvantaged Louisianans. That doesn't really thrill me. What does thrill me is a community-based rebuilding day where a community organization is addressing their concerns about blight and safety by hosting a rebuilding day. I, the scholar, would like to attend to learn more about the community. I hope to work side by side with residents to better understand their perspective on life in the neighborhood while helping mitigate the challenges they identified as a major concern for their community. Do you guys see the difference between those two statements? Okay. All right. Now, there is a piece in here about confirming placement with practice site, and that's more if you are only going to be volunteering in one place and it's going to be a little bit more like a job. And so if you're not doing that, don't worry about it. And you're probably not going to worry about it. So just so you know that, track all of your hours and track it forward. That's the primary place I'm going to be looking for your hours. So let's see. Already went through all that. The final thing I want to say about this is that the evaluation of scholarship, we don't offer grades. I basically look for, did you do it? Didn't you do it? Are you making an earnest effort at participation? And participation is defined as attendance to at least 75% of in-person or remote learning opportunities, submission of work by deadlines indicated by staff, and demonstrate participation in activities. That's it. Bar's pretty low. And then you get $500 a semester. So then we have also final things at the end of this document, the program handbook, as well as in separate sections in Google Classroom. We have guidelines for these different, these are all learning objectives. There's also all the learning objectives. We have for these different things. So if you're really curious about, what the windshield survey needs to look like, here's the structure of that. Then also the reflective journal guidelines. There's plenty of support. I even included verbs for you. And then here's also guidelines for final projects. And so I have like the page numbers and everything. You guys, I've really organized this for you. Okay, so I'm gonna take pause and just see if anybody has any overarching questions or if the scholars want to say anything, the existing scholars, anything really jumped out to them to mention.
I do have a question about the oral presentation and the scholarly paper. Who specifically is the audience when we give the oral presentation and the scholarly paper? Like, is it just like internal house, or is it I don't know. I just wanted a little bit more information of like where it goes. Or
Sure. So I would say that we'll probably invite the all of the scholars if they'd like to attend. We'll also invite your community of interest and I guess anyone else that you think would benefit from your work. So the idea is ultimately that your work would be beneficial to someone and that someone gets to hear what you did.
okay, thank you.
Sure. Okay. All right. So on Google Classroom, you have your seminar stuff. So this is where these meetings will go. You'll see a line for each one of the meetings. This is the first one, orientation. Here are your reflective journal assignments. I have already set them up and due dates. When you do miscellaneous reflections, then you'll go into this additional reflection. So you can do additional ones for like credit. One thing that I recommend is that, oh, here we go. Scholar's final project. I'll finish saying that in a second. Your Scholar's final project. We've got the final paper guide that's a little bit more bulked out than what's at the end of your handbook. Windshield survey. These are the guidelines for that. That's due December 4th. Literature review guidelines, how to write a better research article, terrific data sources, scientific writing resources. Discussion series. So sometimes like this past summer, we watched The Pharmacist. A small group of us watched The Pharmacist, which is a 4-part documentary about big pharma and pharmacists from St. Bernard Parish. It's excellent if you haven't seen it already. And so that kind of thing will go here. And then I have a whole section on hours. Here's your learning opportunity decision tree. Here's ideas for learning, ideas for service, and miscellaneous engagement ideas. Honestly, I built these out so long ago, I couldn't even tell you what's in there, but I do have it on my to-do list because you guys are here to go in and make it more complete. And then under here are evaluations. You can see the welcome survey went live and the orientation evaluation will go live at 7 when we're done. So let's see. I'm going to open this. So under this one is engaging ideas other. And so what I've been doing is throwing stuff in this document that our speakers recommend. I also have in here how to log documentary watching for hours. And so one of my favorite things are documentaries. And I believe that that is very good, well-spent time. And so I want you to be able to count it. There are 2 separate steps to make this count. And I want to be clear about this with everyone. So whatever the documentary runtime is, plus 1 hour for reflection is what you put into Track It Forward, which is the tracker we use for time. To submit a reflection in Google Classroom, you also go into Google Classroom classwork and that additional reflection. And so just want to point that out to you. That's what I mean by that. So here is your time tracker. And so you're going to have in the quick start guide, a place to look to that gives you instructions for how to get your account set up. When you're logged in and you go to log hours, you can verify your hours 3 different ways. One is by an email signature to the person who is running the event. Another one is with a photo. And third one is to drop a GPS pin. My favorite is the photo because then I get to use your lovely faces for things rather than stock images. And I want you to have fun with those pictures too. I mean, selfies are great, but like if you want to really like dress up or something, I would be grateful. So here you can put in the number of hours, the date you volunteered, we have to do a lot of data entry for this program because it's a HRSA program. And so we ask you a lot of questions. Please fill this out as well as you can. So what was it, service, learning in class or service? What was the name of the organization? What kind of organization is it? All of these kinds of things. It's actually really important that this gets filled out. And all of this will be tagged back to your personal identification code. So on the actual printout data, no one else will be able to tell besides me who did what. And you can see here you have a little success bar, so it gamifies it a little bit. You can see how many hours towards the 40 hours you've done that semester. So that's kind of nice too. So that's Track It Forward. I think I'm running out of things to tell you. This is a lot of information, so I thought we would just do this one thing tonight. Let me pull up the quick start guide for you so you can see what I keep referring to. So here you can see, y'all can see this, right? Yeah. Okay, you can see if you go, you can sign in right now. You can go to classroom.google.com and then on the classes page, add, and then add that code. And then the other big thing is Track It Forward. You can also download an app for that, which is really nice. So I will go ahead and email this to y'all at the end of this. And now I want to say that that's pretty much it. The next session we'll do, if it's okay with everyone, I'm just going to go ahead and set this as our meeting time. The 4th Thursday of the month. And I'll add that to our classroom calendar. If you want to add the classroom calendar to your calendar, if that's something that you feel comfortable doing, I can't do tech support. If you can't work it out, Google it, because that's all I would do is Google it. And then our next session is going to be about social determinants of health, and I'll be probably the one to provide it. And so I'll be sending you some readings for the next session in advance. So I'm going to stop talking and I'm going to leave a long air silence, and hopefully you guys will ask questions, and maybe either of me or of the existing scholars, or the existing scholars can say something that they wish I had said.
I don't have much to add, but I want to emphasize, I know the beginning of any kind of group meetings or any kind of program can seem intimidating. There's a lot of information to take in. But I think over time, as you kind of have a couple of meetings here and there, and Robin is great at like updating you every meeting, like on what is coming up and what needs to be done, sending you emails. So just keeping those things in mind, I think you should be fine. And of course, there are a lot of cohort members, including me, who are a year ahead of you guys, and we went through the same thing. So if you have any questions, I mean, Robin can provide those, or I will put my email on the message or the chat box. If you have any questions, just ask and I'll try to help as best as possible. But there are a lot of exciting sessions. And I think the biggest takeaway for me so far, I'm still in it, so I haven't finished it, but I think I really liked meeting all the different professionals, the health professionals, and seeing how the social determinants of health are involved and impacts the patient care in those respective fields. So it's been really cool because, and we've even done like in-person tours of like, let's say the dental building. I've never imagined doing that. So it was kind of cool. It's really cool. And I think you should be very excited for the 2 years. And there's some key takeaways.
Anyone else? Shakara, do you want us to share some thoughts? I wonder if she had to drop off. Okay. Well, it's been really, really nice to meet you guys. And I really appreciate, I know this is a lot of information and it's a hard time of day. My biggest recommendation is to grab a snack and really settle in, because this information isn't always easy stuff, you know, and it can be really a meeting or two myself. I really was like, I don't know, it's like 6 o'clock and didn't prepare for it. And I wished I had, because you don't want to feel rushed or like you're hungry and distracted, because it's good stuff. And so anyway, I really appreciate all of you, and I look forward to working with you guys. And I will send out, not tonight, but tomorrow, the quick start guide. Actually, no, tonight, because I want you guys to fill out this evaluation. Okay. But anyway, it's really nice meeting y'all, and I hope everyone has a great weekend.
All right, thank you.
Thank you.
Thank you.
Thank you.
Thank
Have a good day.
Thank you.